Alrighty, we're in the exciting part 6 of the sympathetic nervous system receptor experience, and we're in table 14.2, and down here we have the receptors that are referenced as beta 1, beta 2, beta 3, alpha 1, alpha 2. Let's get really up close and personal with these specific receptors. Okay, so 5 different receptors for any one molecule, given that it could be epinephrine. What happens if it binds to a beta 1 experience? We get generally a stimulatory event, and we're going to increase the function of the heart. Okay, heart's going to be moving right along, shall we say. And then we're also going to stimulate the kidneys to release renin. Okay, what does renin do for a living? The ultimate outcome is to increase blood pressure, increase blood flow to the heart. Okay, that's the purpose of renin. So 2 stimulatory events is we're going to make the heart more forcefully contract and more rapidly contract. We're going to make the kidney release renin, which activates angiotensin, and then that means that we're going to be having increased blood pressure. Everything you want to have more filtration at the kidney level. Okay, and of course increased blood pressure means that we can work harder. Okay, then what about beta 2? Beta 2 is actually, we're going to increase blood flow, and we're going to increase airflow to the lungs, blood flow to where we need it, which is mostly the heart and skeletal muscles and the skin. We're going to do it, though, by relaxing and dilating the channels. So we're going to dilate the bronchioles. We're going to dilate the arterioles. We're going to increase both the airflow and the blood flow, and we're going to do it by relaxation. Okay, and then the number 3 beta receptor is for adipose tissue, and I've told you this many times before, and I'm going to say it again, that a peak level aerobic experience, which is the heart is 100% aerobic. It loves to eat fatty acids, and so we're going to supply it with fatty acids. Once you start running, the muscles know how to dial the number for adipose tissue, and it ships out the grease, right? So the fatty acids get shipped out. Now if you're sprinting and you're not aerobic, you're not going to use much of this at all, as it turns out. Okay, you're going to be using local supplies of creatinine, phosphate, and also glucose from glycogen. So if you want your adipose tissue to be affected in any way, make sure that you're not in sprint levels of intensity, you're in aerobic levels of intensity. That means you can still speak to your running partner. There's air, plenty of air, and you can just keep on going forever and ever. Run your 15 miles a day, every day, whatever that is. Okay, so those are the beta receptors. Then you have your alpha receptors. Okay, now in this case, in a sympathetic response, you want to turn off the blood. Okay, let's have the blood go off. Okay, in order to get the blood to go off, we have to actually stimulate contraction of the sphincters at the arterioles. So this is actually a stimulus. Okay, that means we're going to increase. I should have probably used a more reddish color there. At any rate, the idea here is that we're going to stimulate the alpha 1. Now, by stimulating alpha 1, that means we get contraction, and we get the blood vessels to contract, less blood flow to the capillaries, less blood flow to the target organs of the abdominal cavity, the viscera. Also, your mouth might go a little dry. Okay, now this is particularly the case of terrifying experiences, not so much so the stimulation to have a fabulous run, but it could be something more associated with terror. At any rate, so we're going to turn off the, in this case, turn off blood flow. Okay, and then down here we have a really interesting experience, is that we're actually going to prevent insulin from functioning. So that's another detail of exercise, is to turn off the effects of insulin, which is to say you don't want your nutrients or your glucose to go from the blood to the cells. You want your cells to express glucose and fatty acids, right? So you want the nutrients in the blood. You don't want to absorb it and try to do some growth or anything like that. So that here is basically we're blocking insulin. Okay, that's the alpha-2 experience. Block insulin. Okay, so we have that clear now. So beta-1, turn on the heart, make the heart work, make the kidney work. Beta-2, dilate the airflow to the lungs and the blood flow. Dilate, relax, increase blood flow to the heart and the muscles. Number 3 is to stimulate the output of fatty acids. Number 4 is to turn off, contract the arterioles and capillaries going to the abdominal organs. And then number 5 is turn off the effects of insulin. I'm sorry, not number 5, but alpha-2. So this is alpha-1 and alpha-2. Okay, so we have 5 receptors ultimately at work there, just the way you like it. Okay, so that's an important detail. And they're listing vast tables worth of fun organs and all of that kind of stuff. Now, this is really important right here. This is the big overview, levels of autonomic control. And how do we control our autonomic nervous system? Generally speaking, is that it's something that comes from practice. But ultimately, the cerebral cortex of the frontal lobe up here has a role that you want to do something. Okay, and you might be, how shall I say, activating something here. So we have emotional input. So what is the highest level here? It says the hypothalamic stands at the top of the control hierarchy in the integration. Okay, so ultimately we observe something, we evaluate something, we have an emotional response to it, it's good or bad, and then we have a hypothalamus experience which regulates the overview and integration, and we basically have to create coherent internal dialogues. So this is the boss. Now, the boss can get a little bit wiped out by strong emotion, but nevertheless, there's going to be some emotional content and import. It could be exhilaration. You could be feeling so good that you're exhilarated, and you end up doing much better. Great athletes, great artists, great singers, great basketball players, football players, anyone who's engaged in some sort of endeavor in which excellence matters is going to have an emotional experience, and it could be an experience that's supported by excellence, or it could be an experience that's supported by anger, frustration. It could be something influenced by terror. So there's a number of emotional possibilities here. The richness of the emotional environment plays a role. It could be supportive or it could be disruptive, one way or the other. But the overall effect here is on the hypothalamus. So if you're somebody who's cool as a cucumber under stress, and you use your stress to give yourself more juice and more energy, and you just sort of feel the buzz of the emotion as opposed to the disruption of the emotion, then you could be in good shape, because your hypothalamus then will function at the highest level, and it will use all of these various levels of neurology through here to create, how shall I say, an informed and integrated internal dialogue that has integrity. Okay, so you want to improve your internal dialogues and have them have some level of integrity. Okay.